hello, health heads. Welcome and thank you for checking in to this dose of the Healthcare Uprising. I am your producer, Jeremy Carr, here with your host, Heather Pierce. What is on our agenda for today, Heather?
Today we are having Dr. Ryan Polselli, who is the CEO and founder of a really amazing startup called Mammolink. Mammolink is essentially a mobile mammography bus. He is a trained breast imaging radiologist, has worked many years as a physician, and now he's bringing basically Mammolink is the bus. Like you can get on the bus to get your mammography for those preventive screenings, ladies. So he's making it more accessible, easier to do because we know how hard it is. So really excited to have him on today.
And something to note from the conversation, making the mammography more comfortable for the patient
Also,
as well in a big way, which is a big problem with this treatment in the past that they're solving for. So all you ladies out there, stay tuned. Here's our conversation with Ryan Polselli from Mammolink.
Hi, and welcome to the Healthcare Uprising podcast. Today we have with us Dr. Ryan Polselli, the CEO and founder of Mammolink. Welcome to the show. We're so happy to have you.
Thank you, Heather.
Yeah. We're going to talk about all of the great work that you're doing in women's health and breast imaging today. So I am definitely invested into this. We cover a lot of women's health on the show, so this is perfect. So with that, give us a little bit of background. What you've done. You've been a physician. You've started this company. Kind of what has brought you to this point. So just give us kind of like a brief background, so we know who you are.
I've been in breast cancer screening and diagnosis. The one field that I said I'd never go into, I actually ended up going into it for years now. Graduated med school 2006, and basically been doing the status quo forever until about 3 years ago. Just got fed up and said enough is enough. You guys aren't listening, and I can do it better than you. And so since you won't listen, I'll show you how to do it. And basically just started our own company, and been doing that ever since.
Love it. That's very uprising.
That's what I said to all the other podcasters when we started the Uprising.
That's right. All the rule breakers, right? We're here to shake things up. I love it.
It's funny you say that, because our first set of what do you call them? The core principles, core values was disrupt. So it was an acronym for diligence, integrity, service kind of thing. So we're definitely on the Uprising bandwagon.
Yeah. We are the disruptors. That's what we well, we're here for it. Well, I'm so glad that you're here to talk about Mammolink. So you mentioned you were like, I can do this better. So what was happening that made you say, I am leaving this kind of traditional system of way of delivering, I guess, imaging, right? I think that's where you specialized in, and then you're like, okay, let's go.
I've always been the guy with like ideas that, to improve things, that kind of thing. And I can remember one specific example. I don't know, it's probably been about 8 years ago now, where there was a patient questionnaire, a very popular one, that identified high-risk patients. So if they're going through the screening process, they answer a few questions. They say, I'm at high risk. I have greater than 20% lifetime risk of breast cancer. And then if that's true, the medical societies say, well, you should get an MRI. And most insurance companies, if you prove that, will pay for the MRI. So to me, it was a no-brainer, right? Why don't we introduce this breast cancer screening questionnaire, identify the patients, we're being compliant with the medical society recommendations, we're saving lives, it's not costing patients anything. And then guess what? On top of it, we're going to also make the imaging facility more money. And so, of course, I presented to, the powers that be, which, by the way, are never physicians anymore. I think physicians are better described as employees than healthcare executive leaders nowadays. And so I presented it, and, that's a really great idea. So when are we going to do it? Well, not now. What do you mean? Well, we'd rather make our money by doing, PET CT. It's more profitable. And then you'd have to go through committees and HIPAA and all this and that. And I was like, wow. Just that was the first time it hit me that they know, but it's so dysfunctional, they don't care, or they're not going to be able to do it. And that's kind of just the first example. And then there were, many, many more after that. And finally, I just said, well, you know what? The only way to get this done is to do it yourself.
Yeah. And
Um,
you want to deliver care working at the top of your license, right? Like, this is
yeah,
why I got into this business, not business,
absolutely.
but this is why I got
Yeah, yeah,
into
yeah.
this, right? To care for
Yep.
people, to really do the right thing.
Sure.
And the system
Yeah.
is not allowing you to do that. And
No,
we hear that all
completely
the
the
time.
choice. Yeah, and I'm not alone. I mean, I think almost all the physicians feel exactly as I do. But what
Hmm.
choice do we have, right? I mean, it's you either. I mean, where are you going to go within the system when it's all dysfunctional? I mean, there might be brighter spots, but you're still dealing with the same issues. So you have a choice: do I leave or do I stay? And I think increasingly people are leaving,
Hmm.
unfortunately.
And creating companies like yours. So
Well,
can
yeah,
you
that's
share,
the good part.
yeah, can you share a little bit more about like, what exactly is Mammolink?
Sure.
Obviously, we know why you brought it to come to bear, right? Because the system
Yeah.
wasn't working for the patients or for you for that matter. So what
Right.
does Mammolink do for the community? And you're just in Florida right now, if I'm correct.
Correct. Yeah. So, I mean, we started this basically. I said, what would I want if I were a patient? And, having listened to the same patient complaints and difficulties with the system over and over and over again, I had a pretty good idea about what to do. And so when we built this, we just said, we're going to build it exactly as if I was a patient and for the patient. So 100% patient centric as much as we could be. A lot of the
Hmm.
things are still, you're still dealing with, legacy parts that are obstructive within the system, but we're trying to get around them as much as we can.
Hmm.
And then create a great patient experience. And if we do that, then who cares about the bottom line, because it'll follow. And you'll be successful. And that's kind of how we did things. And so far it's working, knock on wood. Not always easy, but working.
Yeah. So Mammolink is like, are they mobile buses that show
Right.
up?
Yeah. 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 So sorry,
Okay.
leaving that part out. Yeah, we're a mobile mammo company. Everybody focuses on the mobile, which I get it because it's the most visible piece of this. Which, I say we're patient centric first, and the mobile is kind of an extension of that.
Okay.
Because if you're truly patient centric and you're in the field of screening, you want to make it easy. Otherwise, people aren't going to participate. So we're putting the units at their work,
Hmm.
in their communities, in their neighborhoods, that kind of thing. And so we have 5 buses right now. We basically cover everything from Gainesville South, although we do statewide tours. So we'll hit Tallahassee and all the way down to the Keys and things like that. But all over the state of Florida right now.
Okay.
That's a lot
Yep.
of land to cover.
Hmm.
Florida's huge.
It is.
Even
It's
coming
very
from
sweet.
Arizona, I can say Florida's a big state.
Yeah, it's
Yeah.
long.
Yeah,
It's
very
very
long.
long. Yeah,
Yeah.
especially when you hit the Keys, you think you're there, but it's another 2 hours to the tip.
I've driven from Georgia to Key West. That is
Oh,
quite the
geez.
ride.
Oh.
It is. It is. It is. Yep. I hear it from
Yeah.
our drivers too.
So you have the buses, but do you also have like actual physical locations as well?
No, no, no,
Okay,
not yet. But
not yet.
yep, yet.
So it's really the mobile mammography bus, Mammolink, that is what is deployed out into these communities. So you
Yes.
show up, as we say in the healthcare industry, to meet patients where they are, right?
There you
Literally.
exactly. Yes, I love that. And we've packed everything that's in a traditional brick and mortar, with the exception of an MRI machine, and biopsies, all into the bus. So
Okay.
diagnostics, ultrasound, mammography, the whole 9 yards.
And what you're saying, it's not just the mobile part, it's the, you know, the the consumer focused, the patient focused aspect of it. So what is actually really different about the patient experience once they get on the bus compared to walking into their
Right.
doctor's office?
Yeah. So everything is tailored to them. So it's one stop, which is the biggest difference in my mind. If you talk about the traditional screening process now, it's get a script from your doctor, get an appointment. It's like 10 steps. And then if you
Hmm.
have dense breast tissue for screening breast ultrasound, it's like another 5 after that. It's a 2-step process. You're to the imaging center twice. You're missing time off from work. So we have condensed it all into one, basically, if you get the ultrasound, to 30-minute appointment, and that's it. And you don't have to bring a script. We have everything for you, and we basically do the whole thing right there. And then by the end of the day, we text you your results, so you don't have to lose sleep over
Oh
it.
wow.
So I can
Yeah,
just show up
yeah.
without an appointment or like
Without
without a prescription at least?
without an appointment or without a prescription, we'll still get you in, but it is better if you make an
Well,
appointment.
Sure. I mean,
Maybe
yeah. I mean,
every
appointments are always
2 Yeah,
good. Yeah.
exactly.
In the
Yep.
same day too. That's
Yeah,
huge.
Yeah. And
yeah,
to not have this, because literally everything you just described,
yeah,
I have gone through that many,
yeah,
many times.
yeah.
Because I had to start getting breast cancer screenings early because my mom had breast cancer.
Ah,
So,
yeah,
and I'm 49 now. So,
yeah,
but also 100% admit to you right now, I do not
yeah,
go on the regular cadence that you're supposed to because
yeah. Nobody does.
it's a big pain. I mean,
It is.
literally
Yeah,
it's a pain, but it's also just it's inconvenient. So,
yeah, yeah.
um yeah, so I get it.
Yeah,
Can't
yeah. The harder
can't
something, I mean, the harder it
yeah,
is, the less
yeah,
screening is done. Period.
right,
It's as simple as that. If it's super
right.
easy, everybody does it. If it's difficult,
Yeah.
nobody does it.
Well, and also like thinking about if it's kind of like getting yourself into that mode of being like, all right, I'm gonna go do it, right?
Yeah,
And if it's an appointment that's out really far in advance and you have to go through all these, it's like you lose that momentum and that
yeah,
desire to even, you're like, ah, screw it, I'm just not gonna do it. But like if somebody would show up in a bus and be like,
yeah,
hey, they're here, just 30 minutes in and out, I'd be
yeah,
like, no excuses. Like
yeah,
just
yeah,
I'm in. And
yeah.
screenings and there's some really great stats I think we should probably talk about the
Yes,
importance of screenings, which we know
yeah,
are really hard for people to do, but they have a
yes.
really big benefit. Can you share maybe some statistics around that kind of preventative screening and what that how
Well,
that can
yeah. I
change
mean,
somebody's
I think
outcomes?
everybody kind of knows, early stage breast cancer is curable, late
Mhm.
stage is not, and so that's the biggest thing. So if you get screened regularly, and this is one of the greatest success stories in medicine with breast cancer. I mean, it used to be terrible, and people died all the time, and now that we have screening mammography, people, I know people that have gotten breast cancer twice or three times, and they're doing great. In their 80s, and they had a great full life. And so, yeah, I mean, it's just so important. And you bring up a really good point. So, if you're acutely ill, you've been shot or you're having a stroke or something, you'll pay $10,000 to jump in an ambulance to get treated, right? Every minute counts, and you're willing to do anything. But if you're feeling great and it's just a screening, out of sight, out of mind, you're
Mhm.
not going to go to that extreme. So then it becomes very important for it to be easy. And so if a bus shows up at your work and they're like, hey, your employer promotes it, take 30 minutes, just go out to the bus, get screened. Your friends are there, your work coworkers are there, everybody's on board, having a good time. All of a sudden, everybody gets screened every year, and ultimately more lives are saved. So it's awesome.
Yeah,
Yeah.
that's very true. Um, Curious too, in terms of insurance, how does that work? Because mostly mammograms are covered by
Right.
all insurance, I think, at this point. I mean, I
Pretty much.
don't think
Yes.
anyone doesn't,
Yeah.
whether that's Medicaid, Medicare, private,
Yeah.
ACA plans.
With no
So,
cost sharing, all insurances pay for screening mammography.
okay, so
Yeah.
really
Yeah.
anybody can walk on your bus
Correct.
and
Yeah. I
they don't
mean,
have to
they
worry
do
about, yeah,
stipulate, I think some of them say 40 and over, some of them will say 35. In Florida, we have a statute that you're allowed to be screened once between 35 and 40. And so there's a few different rules as the age gets younger. But for the most part, once you're of screening age, they all cover it yearly.
okay.
Yeah.
Once a year? Is it once a
Once
year?
a year. Yeah, it's once a
Okay.
year. Now, I mean, some insurance companies will say once every 365 days, and then some will say once per calendar year. So you got to be a little careful so you don't end up getting a bill from
That
from the insurance
pesky
company.
language
Yes,
they put in our,
Those
it
damn
did.
leap
It did.
years, man.
yeah. Yeah. Oh
Yeah,
my gosh. Didn't even think about that.
screwed
The leap
everything
year.
up. Yeah,
And clearly the fact that I had to ask, is it every year? I'm not
yeah.
going every year.
Well,
I'm like,
you're
I don't
just
know.
like everybody else. So, yeah.
What about the equipment itself? Because one of the things, that you hear from women, particularly older women, older, your seniors, harder to
Mhm.
get them in for preventive screenings because it can be painful, especially as you
Yeah,
get older and, your skin just gets thinner, all the things that
yeah.
happens as we
Yep,
age.
yep.
Is there any advancements that you're seeing or that you're already implementing in the equipment that you have on the Mammolink
It's
buses?
it's gotten much more comfortable than it used to be. So the days of the old analog mammography before digital came along and before tomosynthesis came along, they used to have to really compress to get good pictures, and it was really painful from what I understand. I've never had a mammogram yet. They are encouraging me to do so just so I can feel the experience, but I've resisted. But nowadays, with the digital screening mammogram and tomosynthesis and stuff, the images are so good. You don't have to compress as hard, and they even have a lot of they have now patient controlled. You squeeze it until you feel uncomfortable and then stop, right?
Okay.
And so I very rarely hear the complaint of pain anymore. Very rare.
Okay.
Yeah.
Now that's some words to get out to people right there.
And
Because
that's
the most discouraging thing about it for most
You're
women, right?
correct. Yeah, I know women that
Yes.
won't have one because they're afraid of the pain,
Yeah, yeah. I have a really high tolerance for pain, so like
Yeah.
I feel like I'm not like the greatest like base like or benchmark for what it is. I mean, I've had several. Again,
Right.
haven't done it
Yeah.
yearly. And I will say that the last time I did it, I believe it was last year, it was probably the best experience in terms of
Oh, good.
lack of pain that I've had. And
Yeah.
it did feel like the machine and the whole thing was different.
Right.
It's
Yeah.
like, and Jeremy, now he's a breast imaging physician, so you've never experienced or seen what we have to put our
I
boobs into. I mean, it's
have
like a
seen it
thing.
on TV actually.
Have you?
I have seen it on
Oh,
TV.
okay.
The plates
Yeah. The
Yeah.
place.
clamping.
Yeah,
it looks like a
now they
vice
have-
grip. Yeah,
Some
like
of them have
it looks
cushion
very uncomfortable.
pads. Yeah. It's,
Yeah.
yeah.
Yeah. And, I
They're
mean,
doing
truthfully, being a woman, and especially if you've had children, it's like you get to a point where you're like, whatever. Like, there's everything that we have to go through. Like, it
Yeah.
becomes like less and less of like a I don't know, uncomfortable experience
Yeah.
because of all of the parts and things that we have to have looked at.
Yeah. I think, once you've
handled.
had a child, nothing matters after that.
No, really. I remember when I was having my second son and it was a planned C-section. My other son was an emergency, so I was not conscious for it. But I remember my OB saying, "Hey, we've got some student anesthesiologists here. Do you mind if they watch?" I was like, I don't care about anything anymore. Whatever.
Yeah.
And
At that point, you don't care.
you just don't eventually.
Everybody else has seen it.
You're like, yeah, it's cool. You can touch the things and move it around into the machine. Like, what? Just get it in there so it doesn't hurt. Yeah. I mean, but the equipment though, I've heard about some of these machines, and again, I don't know if this is real or not, if this is because it's all the AI stuff, where like you can lay down and you can, is that a real thing?
There's a it's not FDA approved yet. I don't think they've done the studies to get the FDA approval to show, but it is FDA approved for diagnostics at least, and you can lay in it. And then there's another one, quantitative transmission QT ultrasound, where you can kind of, it's like a I don't know, like basically a silicone glove around the breast, and you just kind of put one side in, and then the water is on the other side, and that'll look at things from an ultrasound perspective. So there are things on the horizon. It's mammo is still the the standard of care and probably the best in my opinion. But yeah, there are other things that make it easier.
Yeah. Well, that sounds promising.
Yeah. I
It's
think
already a lot better, and it's going to be getting even better than that.
Yeah.
Is what I'm getting.
Very true. Yep. And you know what I tell everybody on our bus, I tell the technologists that have been trained, maybe if they've been in the business for 20 years and they still remember the days of cranking the compression down. I'm like, the most important mammogram is not the present one, it's the next one. Because if the most important thing is that somebody comes every year, not that you get one mammogram done. The likelihood, right? So I tell them, if you've made the experience that the person comes back, that's a win. And so I think that's even maybe a little less compression. It's not gonna hurt.
Yeah.
More important to make something tolerable that patients are like, it wasn't that bad, I'll go back.
Right. Exactly.
Yeah. Then
There you go, Heather.
it's a lifetime of screening. Yeah. You got to come on our bus.
I should.
Florida's a long way.
I can find a reason to
We'll
go.
drive out there. We'll drive out there
Okay.
one of these days. Yes.
Well, and hopefully you do begin to
Yes.
expand, and I
Yes.
want to talk a little bit about the expansion piece, but first just kind of within the state of Florida because I know that's
Yeah.
where you are.
Yeah.
And obviously having worked in startup companies myself currently, I
Mhm.
understand like you get the formula right and then you scale into new markets.
Exactly. Yep.
So, and I know you're kind of on the cusp of doing that, but
Right.
within Florida itself, you've run in you have run or ran into some challenges in terms of getting into the rural communities where I think we have, and this comes up on the show all the time. We have a
Yeah.
lot of really amazing companies like yours that are addressing issues around access in
Yeah.
rural. What can you
Yeah.
talk a little bit about kind of what happened with the system that was in place that it kind of inhibited you from going to some of those areas and how did you get around
Well,
that?
it's hard to get everything done on the mobile model in rural areas the way that we wanted it to be done. So they're not going to come back. You get one stop, one shot, right? And so because you're there in an area where maybe there's no hospitals or whatever, so you get one day to do it, and you've got to do everything right then and there. And so like for example, Medicare. If you do a screening mammogram on one day and you bring them back the next day for the diagnostic, if there's something that needs to be worked up, you get paid twice. If you do it on the same day, you get paid once. Horrible
Mhm.
incentive, right? Because it's basically we're incentivizing making it a multi-step process that nobody wants to do. So that's one thing. And then, the other thing is like, even with screening breast ultrasound, I told you, like, you don't have to have a script. And that's because we've been working behind the scenes to solve these issues. But um, the first thing came up is we've identified we have an AI program. So we've identified dense breast tissue. It's sent to the cloud and back within like 30 seconds, and they see it on the screen. And the technologist, okay, you have dense breast tissue. Let's go ahead and get you the ultrasound. Wonderful. But now the insurance companies won't pay unless you have a script. Well, nobody's prepared and brings a script, and they just learn they have dense breast tissue. So how do we do that? And so we, because we're like, okay, well, I can't write them a script because they say that's against the law. That's kickbacks and things like that. And so, we had to go to an attorney, and actually took us about a year to come up with a plan that actually works. And the attorney's like, hey, I think this is brilliant. I want to share this with everybody else. I'm like, please don't. It took that long to come up with it. So, so we've worked it out and we found a way to do it. But it's really unfortunate. There are a lot of pieces in place that are not designed for simple screening. It's kind of the traditional legacy thing that um, it's like Elon Musk. You take him for what he is, right? Good or worse. But in terms of a rocket, he can make a rocket. But you wonder, why are the rockets so skinny? And he tells the story because the roads are skinny, and you have to transport it from there to the launch pad. And so he's like, it would be much better if we had a big fat rocket and we could design it that way. But I can't because of the existing infrastructure. And that's kind of what we deal with in screening, right? And we'd love to do it, but the existing infrastructure and in the background and the laws and everything that were designed with a good purpose, they're really preventing you from redesigning it in a successful way without getting yourself in trouble. So here we are.
Yeah, we get caught up in our rhythms and our habits
Yeah,
societally. It's our roads are the width of our roads is still based on the width of a Roman chariot.
exactly.
That's literally a thing. Our cars
Exactly.
were built the size they are because that's how wide a Roman chariot was, and that's how wide our roads still are.
It, crazy, right?
We could rethink that.
Sure. Sure.
Like it would be
Yeah.
possible but we've just literally for
Yeah.
thousands of years, that's how wide a road is,
Yeah.
just by standard,
Yep.
So
because that's how wide a Roman chariot was.
applying
Yeah.
that same concept. So
Yeah.
you've got an issue with the system and the way that it's built. And when we say the system, we're talking about the healthcare system. We're talking about
Mhm.
reimbursements, right, for
Yeah.
insurance companies
Yeah.
and things like that. And even how like the like you were saying, like you need a script from your primary or
Mhm.
maybe it's your OBGYN.
Yeah.
Um, and then you go, and then if you have dense breast tissue, me right here, by the way, and
Yeah.
then it's like, okay, now I have to go first. Do you think I go for those follow-ups? Like then it's like,
Nobody
oh
does.
crap, now we have to get them to go to this other appointment.
Yep.
And you can lose them, right? Because then you send that patient out into the world
Yeah. And that's
and
what's
it's
happening.
like, good luck.
Yep.
We have no way of ensuring that you're gonna go for
Yep.
that next
And that's
visit. And I
exactly
probably
what's
not many
happening.
do.
Yep. Nope, they don't. I see it all the time. And
Yeah.
actually, that was one of the things that turned me on to the whole concept of mobile first is, I happened to read for another company before this one and I had some exposure. And I was like, man, these people come back every year, especially if we were at a corporation where they
Hmm.
worked. Every
Yeah.
year, and the same women would get on, and it was like their compliance was almost 100%. And then you
Wow.
look at the regular community thing, and you'd see, wait, maybe 50% come back the next year, maybe.
Wow.
Yeah.
That's quite the shift.
Yeah, it is, especially when that can mean the difference between life and death, unfortunately.
Hmm.
So,
Definitely. And
yeah,
what kind of where do you show up with these actually? That I mean, we talked a little bit of employers, right? Like I've seen
yeah,
that before in the past when I actually worked in a physical building. It's been a long time since that's happened. I'm sure it
yeah,
still does. But like
yeah,
where do you show up with these Mammolink buses?
yeah. We a lot of what's really cool. A lot of employer groups are now companies are getting on
Hmm.
the bandwagon, and I think that's awesome. So, Amazon, Walmart, Costco, some of the corporations that have larger benefits packages, but even very, very small ones, mom and pops, will
Hmm.
come to and stuff like that. So a lot of employer groups, a lot of school systems, a huge part of our
Oh, okay.
business for the teachers.
Hmm.
And that's actually been one of our most successful projects is the school systems, and it's very rewarding too for that one. If you happen to find, and every year we do, and then yeah, those are the two. And then also now we're finding healthcare groups. There's an incentive from Medicare that unfortunately they said every 2 years, but if you have if you the majority of your patients are screened every 2 years, then the insurance companies get reimbursed. They get more stars, higher reimbursement.
Uh-huh.
And they get penalized if not as many get screened every 2 years. So there's always a list going around of patients that haven't had their mammogram that these groups would like to be seen, and so they give us a call. I guess they figure the captive prisoner, if they come on for their appointment, just for their regular medical appointment, like you're not leaving until you get on the bus.
Yeah, and a lot of
Yeah.
Medicare plans offer like a gift card to get people
Yes, even
to
that, right?
do the mammograms or
For that very
colonoscopy, that
reason.
sort of thing.
Yes,
Yeah.
yes. The HEDIS measures is
Yeah,
what they call
exactly.
it. Yeah.
Oh yeah, I can talk all day long about
Yeah,
that
I
stuff.
knew you could. I remember your
So they're
experience.
literally like bribing people to go get their screenings done.
Because,
Yes, yes.
That's funny.
but the crazy part is, like to your point, is that the
Yeah.
system isn't built to encourage people to go through it.
Right.
And also like if you don't do the screenings, like you had said earlier, the
Yeah.
late stage diagnoses
Yes.
are not good. So you would think they would want the system to work for the patients because it's in the insurance company's best interest because it will cost them less.
I learned a big lesson with that. And I was the same. I'm like, this makes no sense, right? Why are we not doing more to incentivize screenings? And really, there's so I thought too that the insurance companies, and it turns out that this is what I was told, and I've looked it up since, and it's true in research that the average member of an insurance group is only a member between 1 to 3 years.
Mm,
So if they go to because the short term of screening incurs a little bit of cost. So if they go to the extent of encouraging this short time cost for screening these, they're not their patients when they would reap the rewards. They've
that's
gone
right.
to, if it's Cigna, they've gone to Humana. If it's Humana, they've gone to, and so nobody's like, well, I'm not going to be the one to pay for everybody else's benefit, and so nobody does, as far as the insurance companies go.
Yep.
And then of course, it's a big business on some of the downstream.
It is a closed system in the end though, because people switching from them, there will also be people switching to them. So shouldn't they all want to back each other up on that so that they don't have to deal
Yes,
with each other's
I
inherent
am
problems?
totally with you, but that would be
Theoretically,
that's
Or is that just way
logical.
too logical for the
It's
insurance?
way too logical.
probably.
It really is. I mean,
Gotcha.
it's short termism, right?
Yeah.
Yeah.
Quarterly profits and stuff like that they
Yeah.
have to.
Right. Because they would pay less, but they have to pay it now.
Correct.
And it's the paying now that they don't want to do.
Hmm.
Bingo. That would
Yeah.
hurt their reporting for Q1 or whatever it is.
Right.
Yeah.
Right.
Why
Push the problem back. Just push it back. Keep pushing it back.
why invest and put in effort into this thing that I'm not actually going to see the benefit from, right?
That's correct. Now,
Somebody else is going to reap the reward.
That's so narrow-minded, though.
I will
is.
say I don't want to totally, paint the horrible picture, because interestingly enough, more recently, and I think it has more to do with the social trends and the way it's perceived, but they have started paying for screening breast ultrasound, some of them, even without legislation, which I was like, oh, applaud to you, that you're actually doing this. So, and maybe that's just time, things change with time and, social awareness. But in either case, we are seeing some improvements.
We have heard a good number of times on this podcast from people that insurance companies are starting to sway toward the preventative.
Yes,
they are.
And putting everything off like that.
Yes.
All the time.
Value-based care is a big.
Yes, it is.
That's a huge channel with preventative. That's the whole point, is reimbursing for outcomes.
Yes.
That's what value-based care is, versus fee-for-service, which is like, I get paid this amount of money for doing this thing.
Yes.
No matter whether my patient becomes better or worse, it doesn't matter. So,
Correct.
And that's been kind of, so I was working in the value-based care space at Aetna. When it became kind of a new thing, we were all kind of trying to figure out, what is this value-based care? And there was a really big shift. That was around 2010, 12-ish.
Yeah.
And you have these accountable care organizations and you have joint ventures. And so there's this kind of, there's been a shift, but it's been kind of slow to get it right.
Yes, ridiculously slow.
Yeah. I mean, like anything in healthcare moves really slowly. Well, there's just so much bureaucracy. And anyway, I've seen it all.
Yeah, and I mean, it takes a long time to turn the boat, maybe, but if it's turning, that's at least encouraging.
It does.
Yeah, it is. It is.
Yeah. And then companies like yours can plug into that, right? Like you can fix a solution, you can find a solution and fix a problem way faster than they can.
Correct. And so actually, some of our best partners right now have been the insurance groups themselves. I know I talk smack because, there are some stupid things, but, but
you and me both.
Yeah. So, but no, they have been. And, because we're closing the care gaps for them and things like that to help them get reimbursements, but also to, where we're seeing the most success is self-funded employer groups. So people, like sometimes the school districts themselves are self-funded. So now there's this incentive, of course, to make sure there's no ticking time bomb that's going to cost them $1 million in late stage care. And I say that unfortunately because a lot of people look through these things only through the lens of finances. Believe it or not, I think to me they're tied, right? The win is if you can find it early, it's cheaper, but then you save the patient. So however you want to look at it, that's fine for them. I don't have a problem with that. But they're saying, well, we'll invest in this because it's going to come back to us, both in terms of keeping a good, valuable employee alive and also it makes financial sense. So it's the win-win.
That's great. Yeah. And I know I'm like you, I don't want to like sit here and just like trash talk them, but but it takes a lot for them to shift. Yeah. You got to shift your operating model and all those things. But I have seen firsthand companies like yours, both when I was at Aetna and now since I've left, being the company that supports like hitting those measures, making them more efficient, taking better care of the patients that are on their member rolls.
Yes.
It's not they want that. They do. It's not that they don't, because they know that they can't build everything.
Correct.
I'm kind of like stay in your lane, insurance companies, right? And let the Mammolinks of the world and
correct. And we've had some really successful partnerships.
Yeah. Do you currently work directly with have contracts with health plans, and is that part of kind of your growth plan?
Yeah, I mean we're contracted from the traditional, you're an in-network provider kind of thing, and we're basically in contract in network with everybody now. But there are some groups that are particularly fond of our services. For example, Florida Blue, they also kind of own their own group, Sanitas, down here in Florida. It's huge, and we're constantly serving them because they're closing care gaps, and they want to save the money, catch the cancers early, and everything. So they're very forward thinking, and that's been a real successful partnership for us.
That's awesome to hear.
Yeah. Yeah.
I do feel like the Blues are definitely
Yeah.
always like first to adopt with like kind
That's
of
what
these
we're seeing.
technologies, at least in my experience.
Yep.
So,
Yep. Exact same thing here.
okay. And for everyone that is listening, because I'm nerding out over here just by saying the Blues, such an industry thing. Sorry. But Blue Cross Blue Shield, although is known nationally, their plans are like by state. Like you said, Florida
Right.
Blue,
Right.
Arizona's Blue Cross Blue Shield of Arizona. I think if you go into Washington, it's called like Providence or something like that, or
Yeah.
Primera.
Yeah.
Yeah, so they're different. They're kind of individually run in each state.
Correct.
So
Yeah.
yeah, there's a little
And
healthcare.
so does that, because I'm thinking of your expansion to other places, does that make it difficult to move to other states, even though you're already established in Florida, the difference between the states and legally and whatnot?
Yes. So we have to, I mean, the insurance contracts are very specific and regional. So we have to start the whole process over. And that insurance, it's horrible. It's one thing that, like, so it took us 5 years to get all the major contracts. And there were a couple holdouts, and I won't name names, but we actually ended up having to get a favor on, basically the legislators in Capitol Hill in Florida to talk to one of the lobbyists, and as soon as that happened, like 2 days later, we got a contract that we've been waiting on for 5 years. And
Wow.
and that was the
Wow.
last one that allowed us to actually start, because you can't start without the major contracts. You won't get paid. Especially with the mobile model. So it took us forever. And I'm not looking forward to doing that in every state. And hopefully it's not as bad now that we're partially in, but I know the tips and tricks that we can try to slide by. Yeah, we had to write another one of them. All the board members, just complaining about the process to get in, and finally got in there too. So it's not easy.
Yeah.
Well,
Yeah, it's crazy.
Arizona's all about the mobile clinics these days, man.
we have a lot of rural areas in Arizona.
We have so many.
Yeah.
Yeah, like all of our towns are middle of nowhere. Unless you're in Phoenix or Tucson, everywhere else is the middle of nowhere.
Yeah.
Right.
Yeah. There's a lot of middle of
Even
nowhere.
Flagstaff, like they consider us a city, but we're still the middle of nowhere.
Yeah.
Yeah, I was learning about the differences recently. Yeah. There's a big difference between Phoenix and Tucson and Flagstaff.
Oh, yeah.
Yes.
Flagstaff's not even, we have a college with like close to 30,000 enrollment now, and we're still not 100,000 people.
Yeah.
They talk about us like we're a big city because we're the hub for northern Arizona. Like all the
everything else is much smaller.
Yeah, we're only big compared to everything else in northern Arizona. We're a small fraction of the size of Phoenix. Phoenix is 6 or 7 million people. We're not even 100,000.
Yeah.
Wow.
Even Tucson's like 750,000, I think.
Is it? Oh, I don't even know.
Like 700,000 something, I think.
Right. Wow.
We're not even 100,000 people here. They consider we're the third biggest city or fourth biggest city, something like that.
I didn't realize that.
In Arizona, because Yuma's pretty big too, but nobody knows about Yuma.
Yeah. Nobody cares about Yuma.
There's a lot of people in. Yuma's weird because there's a lot of people there, but nobody talks about it.
It's a weird little town down there. So,
it's basically California. Yuma is basically California.
We digress. I want to talk a little bit about. So you're going to grow into other states, understanding there's challenges. I have a lot of hope for you, though. Just honestly, from like being in similar. In the startup space, trying to move into new markets. Typically, like once you're in with one, you got the connection, and then they're like, you need them in that next state. So I'm crossing my fingers for you.
Yeah, me too.
But I want to talk a little bit about the AI systems that you have in place. When we first met, that has like demographic data, geographic data, patient data, things of that nature. Can you talk a little bit about how this can potentially really change things in the future with all of this data that you are collecting?
I get excited when I get to talk about this.
I'm excited about this.
I think is going to be massive, huge game changer in the next decade. So we're building what I think is going to be the most comprehensive breast imaging database with the best data sets per patient, because we're picking up data that nobody's collected at the same time. And we're feeding it into, the cloud and an AI capable large language model, query-based predictive AI database where we can get insights from the data that we're collecting. What's really cool is we're not just collecting like the traditional outcome data or data by counties, or whatever that's out there by the CDC that they have now. It's actually like data at the neighborhood level, and contextual data, attitudes, opinions, occupational data in terms of like even if you're working a day shift or a night shift, like that kind of stuff is everything that we're going to be collecting. And with that, we hope to be able to significantly improve the whole breast cancer screening process by answering all kinds of questions.
Yeah.
So
that is exciting.
That's good AI right there.
Really?
I get excited when I hear good AI stuff.
yeah, exactly. So I'm super excited.
Yeah, because there could be correlations to things that we would have no idea about otherwise.
Which
right?
was totally what I was just going to mention, because, this kind of Aaron Brockovich moment, right? Like with the data, because that was about the water quality and like inland California, and like, oh my God, all these people were getting sick, and they were able to bring it back to the cause, right? They found the root cause. Do you think that you'll be able to have some of the same?
I do. I think it's logical to assume that that's going to happen. I'm really kind of dreading it because I don't want the drama, because I want to be able to find all the good things. But at the same time, if there is bad out there, which I know that there is, I'm sure we'll detect it. And I think that's going to be tremendously valuable. So yeah, Erin Brockovich, right? So she's just a very keen observer and started noticing these trends. And I think what's going to happen is we're going to find little, basically like kind of microscopic areas of breast cancer that are going to show up, right? Because, if all of a sudden we're going to say, wait, these two neighborhoods out of all the neighborhoods in the state, they have an extremely high incidence of breast cancer, and let's look into this more. So I think we'll end up picking some of those things up inadvertently, which will do a lot of good. In terms of being able to pin down, what's the cause of this, or at least raise a red flag, like let's look into this more. And then, but I also think that, we're going to be able to figure out all kinds of things. If certain occupations have a higher incidence, why? Do we find, even like I was just mentioning, right? What if people that work the night shift have a higher incidence slightly of breast cancer? Is there something about the circadian rhythm and, little biological insights and things like that? I think we're going to be able to uncover with time. But the real reason that I thought of this, and to your point, Jeremy, I think the biggest might come from questions we don't even know yet to ask. Right.
Exactly.
I mean, so, really I started this because I started thinking, I already know the answer, right? So we know that employer groups and things like that's key, making it easy to a successful program. But you've got to get the data to prove it. So that was kind of the original reason for this, right? I'm going to just get the data to prove certain things that I know to be true because I think it'll be very valuable to the way that screening's done. But, along the path, I started realizing there's a huge benefit to society in terms of what this is actually going to do. And so, here we are.
It almost sounds like you're rewriting the equation for how the stuff works. Like your process that you have here, like, is this something that you could see being implemented across the board, like in the actual doctor's offices and
I do,
non-mobile medical facilities and stuff? Because it sounds like this is the better way to do it.
Yeah, you're right. And the really cool thing is, the data that we get now, it's partial data and it's totally skewed because it's the people that go to the hospital or that willingly participate. And it's a total artificial setting. And what we're doing is we're going right to the neighborhood, basically not really disturbing things and getting people that wouldn't come on. So things like incidence of breast cancer, when you look at a map, you're like, why do all the populated areas have breast cancer? It's because we detect it there. But that's not to say that, the Midwest doesn't have it. It might actually be higher, but we don't know. We don't have the data. So that kind of thing. And I think I can't even begin to, this is kind of the cool thing of AI is to understand. I always say, you just don't know what you don't know. It'll be interesting to see what we find.
Yeah.
And do you think because obviously it's not like we're not doing breast imaging, right? Like women are getting mammographies, but why can't the current system get access to this data that you're getting? Is it because it's so disparate and everything is just so disconnected right now?
Yeah. I mean, a lot of it's self-reporting, to centralized databases and it's fragmented and it's, data that is partial, or and they just don't ask a lot of the questions that are wanted right now. We're really focused on this is because I think prior to AI, we had to limit the amount of data. What's useful for us? Okay, outcome data, intervals, little things like that. But now we have the ability to take an infinite amount of data and get the answers. And so, I mean, I'm not the only one doing this. I know, I'm sure there's others that are trying, but we have the platform because we were lucky enough to recently build it. So to get all of these input sources from everything all connected. So I think that's our advantage. But you're right, it's just fragmented, self-reported data and stuff. Like CDC has some pretty good maps, and there are other groups out there and stuff, but it's just real limited.
Yeah.
Yeah.
Yeah. It's interesting as you were talking about, like, are we going to start seeing like higher incidences of breast cancer diagnosis? Maybe there's something going on in those areas. And I was thinking about my mom. I had mentioned she had breast cancer. This was back in, I want to say, the late 90s, because I was in college at ASU.
Yeah.
Um, and she was 57 at the time. She's 84 now. And she worked at FedEx for many years. And she worked in a kind of a call center, an old building. And she still, to this day, insists that it was environmental factors
Right.
that caused her breast cancer. Wouldn't be
Yeah.
great if we could have known that.
Yes.
So it's still to this day, she is absolutely convinced that because nobody else has it in our family.
But you would have to find all the women who worked in that building and get them
Right.
all tested and see what their
Yeah.
whole deal is. And
Yeah, it'd be really pretty complicated. But that's another benefit of this too. So this can
Right.
serve as an early detection warning system if we get enough buses out there and we have enough of the population where all of a sudden, we ask, are there any developing trends in the incidence of breast cancer? And AI analyzes the whole data set and said, interestingly enough, I did find this correlation. You might want to look into it. It's not the definitive answer, but at least it'll give us a heads up.
And
'Cause
that
it's
would
really
probably
can steer the path.
that might encourage more women to say, "Oh my gosh, if you're seeing this, like I better
Yeah.
literally get on the bus," right?
True.
Yeah.
And then you can direct the resources appropriately instead of, like there's so much waste in healthcare right now because we're just, I mean, it's not, a lot of it's unintentional. I don't think they're just intentionally wasting it, but it just
Right.
goes to no good. And so this will actually enable efficiency as well. Yeah.
Yeah,
Yeah.
Yeah.
that would be
I could
pretty
go
cool.
on all day about it.
It's like FOMO for getting mammography.
Yeah.
Well, just the more
Right.
that is the thing, though, the more you know, because if you can start pinpointing certain environmental aspects or
Yeah.
Right.
anything, like you said, working day shift, night shift, like sleep
Right.
patterns or stress
Yep.
levels. And
Yep.
the more you actually can say, we know this about this,
Mhm.
the more people will say, oh, well, that's me. I need to do something about that.
Yeah.
And I
But
think it
if you're
breeds
like,
trust.
we have to screen you to see, like, if that's
Yes.
all you can say to them, it's like, yeah, I mean,
Yeah.
Exactly.
that's somebody else's problem.
Yeah, exactly.
You know what
Yeah.
I mean?
Yeah.
All
Completely.
right, listen, now that I've said mammography FOMO, you absolutely need to find a way to use that with like a tagline. You're like Mammolink, creating mammography FOMO everywhere.
I love it. I love it. Yeah.
It's all yours. You can have
All
it
right.
for free.
Funny.
Yeah, awesome. I'm gonna
FOMO
trademark it.
mammography.
I mean,
It does have a flow to it.
think about that.
Fomography.
That's like a whole advertising campaign. Heather's just put her marketing hat on.
Don't sue me later, please.
No, she said you can have it. I'll hold her to that.
It's all yours. I hope you use it actually, because then I'll get a little bit of pride when I see Mammolink in Arizona.
Like this just makes me hope that this comes to us at some point, because
Yeah.
Arizona could so use this. We have mobile dental clinics
Yeah.
and mobile clinic buses, like go on, get your physical. And we have mobile blood collection buses.
Sure.
And like we have a bus for everything in this state,
Yeah.
I've thought.
you
But
have
then
mobile
you
buses
say this, and I'm like, we
too.
definitely don't have a breast cancer bus.
Right.
We don't have one of those here. We should get one of those
There
here.
we go. I hope we see you in Arizona. We begin to wrap up here a little bit. One thing I want to ask you is, and you've talked about, you're changing the model, right? You're changing the way it's access delivered,
Yeah.
improving the outcomes. If you were to look out 10 years from now, maybe even 5 years from now, right?
Yeah.
Because we know how long it takes to get these contracts. So maybe
Yeah.
5 years is the thing. What
Yeah.
what does the system look like? Like, what is kind of your ideal state of how this experience looks and feels for women that either getting on a bus or walking into an office?
I'm extremely optimistic. And I think that we're going to lead, and people are going to follow. Because I
Hmm.
think that's what happens, right? Well, they were successful. Let me try to do exactly that. And so it just takes one person to kind of break through and say, let me show you guys, and then everybody else will follow. So I'm hopeful that at least in our little area, but I think there are a million people like me in other subspecialties throughout medicine that are doing the exact same thing right now. So I think we're at kind of it's a little mini revolution within
Hmm.
healthcare, or the uprising. Right?
Oh yeah.
Yeah.
The vision that comes to mind is just ashes with like new roots, new branches, sprouting up, kind of thing. And I think we're going to see a really positive future in healthcare, especially with AI and the developments. It might be messy, but I think it's going to be positive. um, I think a lot of work still needs to be done, things that could speed it up. Obviously fix some of the problems with the payer system. Price transparency is huge.
Oh yeah.
I mean, it just, and I'm at odds with one of my own, societies, American College of Radiology and stuff with that. But it's just not fair. It's just not
Hmm.
fair. And it scares so many people away, right? They don't even want to go because you know how much you're going to be stuck with until you get the bill a month later. And it's like, oh my God.
Yeah.
And then, so if that, continues on a positive trend, and um, I think, unfortunately, a lot of physicians, because they're in the trenches, are going to have to stand up, and hopefully there'll be some favorable legislation. I know, like, we're not allowed to own hospitals, but like
Hmm.
if to think like if there was an attorney group where the attorney wasn't allowed to own the group, it'd be like unconscionable, right? So
Right.
why not? And there's some legislation that's been introduced to kind of ease that up. So I'm hopeful that those types of things are going to come along.
Yeah.
And then, of course, who knows what's going to happen with AI? I think, but there's a lot of good that we're seeing from it. A lot of incidental
Hmm.
findings that are being picked up, and finding ways to do things cheaper. So,
Yeah.
my vision is I want Mammolink on everybody's phone,
Hmm.
just one tap away, no matter where you are, and then with that tap, everything at your disposal,
Yeah.
just to make it easy. Just like I basically
Yeah.
want to be Amazon, right? I mean, that's
I
how
love
easy
it.
it is nowadays. So, like an Amazon moment. But
Yeah. Creating that mammography
y-
FOMO.
Yeah.
there you go.
Well, no, literally, it ends up making people want to do it
Hmm.
instead of wanting to
Yeah,
avoid it. They end up
yeah,
wanting to do it.
that's good
Yeah.
to hear.
That's a
Yeah,
big
yeah,
shift.
We should want to live for a long time and live
yeah,
healthy and get
yeah,
more years out of our life. Good healthy
yes,
years too, right?
yep, yep.
Um and you don't have an app today, correct? It's just the website.
It's on my computer over here. It's just it has a lot of bugs. So we got about I'm going to say 4 more weeks.
Okay. Got
Oh,
it.
do
Four
you
more
actually
weeks.
have an app coming out?
Yeah, yeah, yeah. That's part of our
Okay.
whole
In
our
Oh, awesome.
In
ecosystem.
the meantime, where would somebody find you online? As well, are anyone listening in Florida, or if you know
Yeah,
somebody who's in Florida
This actually
right
isn't coming
now?
yeah.
out for like a month, so
Yeah.
then you can check for the
Oh,
app.
that's
There
right.
you go.
Yeah,
It'll be
because
Okay.
we're about a
perfect
month
timing.
behind in our schedule right now. So.
So
Yeah.
yeah, the company is Mammolink, and it's mammolink.com. And then if you wanted to follow me, I'm starting to do more of this, and I think it's important to get the word out and educate. So you Ryan Polselli on YouTube or something like that.
You're on YouTube?
Yeah, just I
Okay. We'll
haven't
put it in
told
the show
one there,
links.
but I'm gonna. Yeah, exactly.
Yeah.
I'm finishing it up right now, so it'll be
We
it'll
get
be
it.
time you get out. Yeah, it's
YouTube is
work.
like a whole
I
other universe.
I start a new
Amen.
YouTube channel every few months.
Yeah, it's hard. Yeah, it's a lot
Yeah,
more work than people. You can't just be like, I'm just gonna go start a YouTube page. Like
no,
it's just not that easy.
no.
Are you on social? Is Mammolink on social media anywhere?
We're on Facebook, Instagram. I think we
Okay,
have a TikTok account, but we haven't made anything yet. So soon.
that's okay.
Yeah.
I'll follow you. Don't worry about it.
Yeah.
I'll make sure I share
Awesome.
all your stuff
Awesome.
out there on the social.
And more to the point, any women in Florida who want to make an appointment with you, what's the best way to do that right now?
Go to the website. A big,
Just the
huge
website.
schedule here. We have you put in your zip code, find me, and it'll find the nearest bus that's convenient to you. Just click on it.
Perfect.
Yep.
Awesome. And then like
Yeah.
any organizations in Florida that might want to bring Mammolink to their property, like an employer group, if you're listening.
Yeah, same thing. Easiest place. Go to the website. There's a partner. Contact us, and you just click on that, and somebody will reach out.
There you
Perfect.
go.
I love it. Well, thank you
Yeah,
so much. This has been
yeah,
great.
yeah. It has been.
I love the things that I can actually get benefit from and have
Awesome.
opinions about, good or
Yeah.
bad.
Yeah.
So this definitely, obviously, breast imaging and getting mammographies is important. So ladies,
Yes.
get them checked.
Mammo.
That's right. Mammo FOMO.
Thanks,
Thank you
Stanley.
so
Thank
much.
you,
This has
Heather.
been a great
Okay.
conversation. Loved
Awesome.
having you on.
Yeah, thanks.
I am like truly like, I cannot wait to see you everywhere.
Thanks for joining us on the Healthcare Uprising. Make sure to hit those like and subscribe buttons before you go, and take a moment to think of a friend and hit that share button. You can find us on all the major audio platforms, and we've got video on YouTube if you want to watch us in action.
You can also find us on social media on LinkedIn, TikTok, and Instagram. Just search Healthcare Uprising to find us. And if you're a new company with a cool new product, if you're someone innovating alternative methods for the health and wellness space, or if you have a personal healthcare journey you'd like to share with us here at The Uprising, please email us at healthcareuprising@gmail.com, and we'll get back to you about coming on the show. Well, that's all for this dose of Healthcare Uprising. Until the next time, keep looking for the good in the world, because sometimes it's where you least expect it.
We are not doctors and we don't play one on TV. If you need medical advice, consult with your physician or a healthcare professional. This has been a Shut Up production.
Shut up!